All right, jumping right into it, we're going deep on primary aldosteronism treatment today.
Sounds like a plan.
And it's all thanks to you guys. You sent in a ton of medical journal articles on this, so
Oh, wow.
we've got to tackle it. You know this already, but it's not your everyday high blood pressure
Right.
and treatment. It's not just about getting those numbers down.
Yeah.
It's about protecting your heart long term.
Absolutely. Long-term health, that's key.
To help break it all down, we've got expert speaker here ready to decode the science for us.
Happy to be here. And you're so right. It's way more than just the blood pressure numbers. First thing, we got to figure out the root of the problem. Where's that excess aldosterone coming from?
Okay, so one adrenal gland or both.
Exactly. That's the starting point for treatment. Makes all the difference.
Like a detective story, huh? Find the culprit before we can solve the case.
I like that analogy.
And speaking of culprits, just a quick refresher. These adrenal glands, what are they exactly?
Oh, sure. Little endocrine powerhouses.
Yeah.
Sitting right on top of your kidneys. They do a lot. But for us today,
Right.
it's all about the aldosterone they're pumping out. That's what's causing the trouble.
Gotcha. So say we've pinpointed the problem, just one adrenal gland acting up.
Okay.
Seeing a lot about surgery in these papers. Is that the usual route?
Yep, you're on the right track.
Yeah.
When it's a single benign tumor, what we call an adenoma, or if one gland is just working overtime, unilateral hyperplasia,
Okay.
taking out the bad gland is often the most effective solution. And luckily, these days, it's usually laparoscopic.
Laparoscopic, meaning tiny incisions, quicker recovery, all that.
Exactly. Minimally invasive. Huge improvement.
I bet our listeners are all ears about those details, especially if they're facing this themselves.
Absolutely. Less pain, faster healing. It's a game changer. But here's the thing. Even after surgery, high blood pressure can stick around. In a lot of cases, even up to 65%.
Wait, really? Even
Yeah.
after you take out the problem gland?
It's true, and it shows why this needs such careful management. See, high aldosterone for a long time, it does damage beyond the blood pressure.
Oh,
That's like a domino effect. Think about your kidneys working overtime to handle all that sodium and fluid retention.
So it's not just about removing the gland, it's about dealing with the damage that's already there.
Precisely. And that's a big reason why even after surgery, some people might need meds to manage their blood pressure and protect their organs.
Wow, okay, so surgery isn't always a total reset button then. What about people who aren't up for surgery or maybe not good candidates? What are their options?
Well, that's where medication steps in.
Mm-hmm.
And the stars of the show are aldosterone antagonists. They block the effects of aldosterone.
Antagonist sounds like a superhero movie.
Uh-huh.
But
Totally.
seriously, how do these meds work? Just soak up all that extra aldosterone floating around?
It's a bit more targeted than that. Think of it this way. Aldosterone wants to attach to receptors in your body, especially in the kidneys. These receptors are like docking stations. Aldosterone docks and bam, it sets off a chain reaction, raising your blood pressure.
Gotcha, I'm picturing it. So where do the antagonists fit in?
These guys, they're receptor blockers. They compete with aldosterone for those docking stations, stop it from latching on and doing its thing.
So it's a battle for the receptors.
You got it. A battle for control. And we have specific medications for this.
I bet our listeners are waiting for those names.
You bet. Spironolactone, that's the classic, been around forever, very effective. Then there's eplerenone, newer, fewer side effects,
Okay.
but might not be as strong for blood pressure.
Makes sense. So we've got the one-sided attack covered. But what about when both adrenal glands are involved? We can't just take out both, right?
You're exactly right. That's a big no-no. Removing both would mean a lifetime of hormone replacement. Not ideal.
Whoa, that's serious. Walk us through that a bit. I think our listener wants to understand the full picture there.
Sure, the adrenal glands, they don't just make aldosterone. They produce a whole symphony of hormones, each one super important for your body's balance. Take both out. Complete chaos.
So it's replacing a whole system, not just one hormone.
Exactly. And that could, with its own challenges, potential side effects, you're trading one problem for another, plus lifelong meds. It's a last resort, really.
Gotcha. So no double adrenalectomy. What's the strategy when both glands are overproducing aldosterone?
We go back to our trusty aldosterone antagonists, spironolactone or eplerenone. It's about management, not a cure.
Okay.
Keep those aldosterone levels in check. Protect your organs.
So manage the symptoms, prevent more damage rather than a one-time fix. But are those the only options? What if blood pressure stays high, even with those meds?
Then we call in the reinforcements. Other blood pressure meds like thiazide diuretics or ACE inhibitors, they work differently, but same goal.
Lower blood pressure, protect the heart.
Exactly. Thiazide diuretics, they help your body get rid of extra fluid and salt through urine.
Right. And ACE inhibitors, they work on that renin-angiotensin system, the one that constricts blood vessels.
Nailed it. You're hitting all the key points. Targeting different parts of that blood pressure system gives us better control, hopefully less long-term consequences.
It's like a multi-pronged attack, hitting it from all sides.
And speaking of different angles, we talked about different types of primary aldosteronism. There's one that caught my eye. Glucocorticoid remediable aldosteronism. Sounds hopeful.
Great observation. It's a rare one, caused by a specific genetic thing. But like the name says, it's treatable with glucocorticoid medications.
Hold on. Glucocorticoids, those are different from what we've been talking about, right?
Yeah.
Really highlights why the right diagnosis is so important. It's not just treating high blood pressure, it's knowing the root cause and matching the treatment.
Absolutely. And for this type, genetic testing is key to confirm the diagnosis and make sure you're getting the most targeted treatment.
So for our listeners out there, if you suspect primary aldosteronism, push for thorough testing, even genetic. Could be a game changer. Couldn't agree more. It's about being your own health advocate, making sure you're getting the best, most accurate treatment.
That's some powerful advice.
It's about taking charge of your health journey. It really is. Knowledge is power, especially when it comes to your health. The more you know, the better you can talk to your doctor and make good decisions.
Totally. And it makes me think about something else from the research, this idea that aldosterone does more than just mess with the kidneys.
Right.
I know we're focused on blood pressure here, but it got me curious. What else is this hormone doing in the body?
That's a hot topic in research right now, and what they're finding is pretty amazing. Aldosterone receptors, they're not just in the kidneys, they're all over. Heart, blood vessels, even the brain.
Whoa, the brain too.
Yeah.
So this hormone we think of for blood pressure could actually impact our health in way bigger ways.
Exactly, big implications.
Yeah.
For example, studies are saying too much aldosterone might directly damage the heart, even without high blood pressure. It seems to be involved in fibrosis, that's like stiffening of the heart muscle, makes it harder to pump.
So even if your blood pressure looks good, this hormone imbalance could be silently hurting your heart.
It really shows that just masking the symptoms with blood pressure meds might not be enough. We have to tackle the root cause, that overproduction of aldosterone, to protect the heart and other organs long term.
Makes you wonder what else we'll learn about this hormone, right? That's what I love about these deep dives. We start with one thing, and it opens up a whole universe of connections.
Absolutely. The beauty of science and medicine. Always more to learn, more connections to make. Aldosterone is a perfect example of that.
Okay, so knowing all this, what's the takeaway for someone living with primary aldosteronism? What's the message they should walk away with?
Early and accurate diagnosis is crucial. The sooner we know which type of primary aldosteronism someone has, the sooner we can tailor the treatment for both the symptoms and the long-term consequences.
So it's not just about managing blood pressure today, it's about protecting your heart for years to come.
Exactly. And that's where talking openly with your doctor is so important. Ask questions, advocate for yourself, push for more testing if you need to. Knowledge helps you take control of your own health care.
And building on that, research is always moving forward. New treatments are coming out all the time, and our understanding of this whole aldosterone puzzle is getting better.
That's encouraging, isn't it? Always hope for better options down the road.
It is. It's not a dead end. It's a process of discovery.
Speaking of, while we've covered a lot today, I do want to leave our listeners with something to think about.
Oh, I like that. Hit us with it.
We touched on aldosterone affecting more than just the kidneys, but research suggests it might go even further than we realize. There's some new evidence hinting at a link between aldosterone and how our brains work.
Wait, are you saying this hormone, the one we associate with blood pressure, could affect our brains? That's a whole other level.
Some studies are pointing in that direction. It's early, and we need more research. But it raises fascinating questions about how our bodies are connected. It makes us rethink what we know about this hormone.
Wow, mind-blowing. So while we've been talking about the heart and blood vessels, this hormone might also be impacting things like memory and thinking. The ripple effects are crazy.
Exactly. It highlights how interconnected our bodies are. What affects one system can have huge consequences elsewhere.
This has been an incredible deep dive. We've learned so much about primary aldosteronism, from the different types and treatments to the potential long-term effects, and even this new research on its broader impact. I feel like I have a whole new understanding.
I hope our listeners feel empowered to talk to their doctors. With all the knowledge we've shared today, it's about taking charge of your health.
Absolutely. And to our amazing listener, thank you for sending in this fascinating material. Your questions keep us going.
It's been a pleasure exploring these concepts with you.
And to everyone listening, we want to hear from you. Join the conversation online and let's keep exploring the world of science and health together. As we wrap up this deep dive on primary aldosteronism treatment, I'm struck by how much we've learned. We started with pretty basic questions, like surgery versus medication, but it's gone so much deeper.
It really has. We talked about potential heart damage, the differences between medications,
Mm.
even genetic testing. It's definitely not a one-size-fits-all situation.
For our listener who's maybe dealing with this diagnosis or knows someone who is, what's the most important thing they can do?
Well, there are a lot of pieces to it, but knowledge is key. Just listening to this deep dive shows you're already being proactive. Stay curious, ask questions, talk openly with your doctor.
Be an advocate for your own health.
Exactly. Understand the condition, the treatments, the long-term effects. And don't forget about lifestyle changes.
Oh,
Meds or surgery might be part of the plan, but healthy habits make a huge difference too. Lowering sodium, managing weight, dealing with stress, getting some exercise, those all create a good environment for healing.
it's like building a strong foundation for your health no matter what you're facing.
Exactly. And lastly, keep the big picture in mind. Managing blood pressure is crucial, but it's not the only goal.
Right.
It's about protecting your heart, your kidneys, your whole health for the long run. It's about living a good life, not just managing symptoms.
Well said. This deep dive has been a true team effort. Our listeners' questions, your expertise, and our shared passion for understanding this complex condition. I think we've all learned a lot.
I agree. It's been great exploring all of this with you and shedding some light on this condition that often gets overlooked.
Huge thanks to our listener for sending in this material. Your curiosity inspires us. And to everyone listening, we want to hear from you. Join the conversation online, share your thoughts, ask questions, and let's keep unraveling the mysteries of health and science together.